Good evening, Dr. Langone. How are you?
I'm well. How are you today?
I'm doing wonderful. I want to thank you so much for your collaboration on this upcoming Biomechanics and Orthotics Innovation Summit, as we call it. And I just want to share with the audience, I wonder if you could share with the audience just kind of how this sort of came about.
Yeah, we were fortunate enough this January at the New York Clinical Conference to run into each other and start a discussion about biomechanics and about the need to really bring a high level, high content, real quality program to the profession. And fortunately, Richard was open to the idea of
Mhm.
putting this together and has just put together this amazing panel where we'll go through some of the basics and then some of the more advanced things in biomechanics, in orthotic fabrication. And it should be jam packed with things that people can immediately utilize and benefit from in their practice, as well, of course, as their patients.
Absolutely. And, collaborating with you has been fantastic. And, you know, I respect you highly, and we've known each other a really long time. And one of the things that we all know is that biomechanics education is lacking in our profession or in your profession really. And among the lower extremity clinicians, podiatrists, orthotists, it's just lacking. And so I think capitalizing on that education was a primary concern for you.
Definitely. We've seen as the profession has become more and more surgically oriented that the biomechanics that we're learning and teaching our students has really scaled back a bit. And for me, I always think of biomechanics as the cornerstone of the profession
Mhm.
because I don't think you can really enter into any form of treatment for a patient where the biomechanics are not involved and are not part of your algorithm and part of your thought process and your treatment plan in order to really successfully address the needs of that patient and to stop their cycle of injury and foot problems and lower extremity pathology.
Hmm.
I think this seminar is going to be amazing. I so look forward to the speakers that you put together because it's really going to be great.
Yeah, I'm super excited as well. I really want to thank you once again. Just so that everybody knows, the date is June 7th. It's 11 until 8, and we're extending it later so we can accommodate our friends and speakers from Australia. So they're just waking up as we're sort of going to sleep. And we have speakers from Canada, we have speakers from Paris, we have speakers from Australia, US. So it's a real gangbuster of an event, and I really appreciate your collaboration and look forward to working together.
Thank you. Honestly, I am honored and a bit intimidated to be on this panel because it really is just people that I've, followed and just admired for the quality of the work they've done for years. So this
Yeah.
is going to be a great event.
Yeah,
Thank you.
for me, biomechanics is near and dear to my heart. Having been one of the founders of Biomechanics magazine back in 1994, putting together this conference was really special for me, and working with you was a real honor as well. So I'm super excited. You have nothing to be intimidated. As a matter of fact, I think they're all intimidated of you being on the faculty.
That's just because I'm a New Yorker.
Exactly. That's why we connect so well. Awesome. I'll see you on the 7th.
Great.
All
Thank
right.
you so much.
Take care.